you. Thank you. I'm Sallie Baxendale. I'm a consultant neuropsychologist and a professor of neuropsychology at UCL. So I don't really work with this group. This is not my kind of day job, but I've been up, well, my interest is the impact of puberty blockers on cognitive function, and I'm going to be talking about that this afternoon. But I'm just going to start with just a quick overview of the idea of the transgender brain. And what that means and what evidence we have to support that. So I'm going to start with just a quick overview of understanding the tools of the trade. So what we are talking about when we are looking at brain imaging, what we're talking about when we're looking at imaging abnormalities, when we're looking at structure, and when we're looking at connectivity. And if we're going to look at a transgender brain, really there's two things we're looking at. There's the idea that somebody's been born into the wrong body. They have a female brain and they've somehow been given a male body, or the other way around. And to really determine that, you've got to determine whether there's a female brain and a male brain. So I'm going to be looking at the evidence for that, and then looking to see how people have tried to use scanning and MRI evidence to say that there's a transgender brain. So just a very quick introduction to the tools of the trade. When we're looking at imaging, we tend to be thinking nowadays about MRI, magnetic resonance imaging. And really, at the beginning, this was used to identify abnormalities in the brain. So these can be developmental or they can be acquired. So with developmental, the brain has somehow developed in an abnormal way. And when we see these abnormalities, we tend to relate them to diagnoses. So we can see that there's been an impact of that abnormality on brain development, cognitive development, and there are behavioural correlates to that. So you can see here somebody's developed with a completely smooth brain. So this is a smooth brain. This has very significant impact on somebody's brain and somebody's behaviour and cognition. It has diagnostic significance. And here you can see there's a band of grey matter sort of in the middle of the white matter. So that's a migration disorder. So this brain did not develop properly. The cortex, all the neurons that should have got to the cortex got stuck in the white matter. They didn't get there. So it's a brain that's developed abnormally. Here, this looks like an injury, but it's actually a developmental abnormality. So the gyri and the sulci were supposed to be developing like that, and then you've got a massive sulcus that developed. So these are the sorts of things that we can see developmental. We can also see acquired injuries. So we've got stroke and abscess and traumatic brain injuries that we can see on MRI. So they're abnormalities. When we look at the transgender brain, there are no abnormalities. We are not looking at an abnormality here. What people have been looking at is variations in normal brain structure to see if they can map that onto a diagnosis of being transgender. So one of the things that people have really looked at is in structural MRI is the volumes of different brain structures. So we can look at the volume or the shape of a structure and say how representative of this of the general population. And generally this is automated now. When I first started, we used to draw around the structures. Now it's completely automated. You put the scan into a program and it will tell you how big, small, different structures are. And you can get hundreds and hundreds and hundreds of measurements from these things. So there are a very large database of normal volumes. But what we need to be aware of with that database, it sounds very scientific. We've got a brain scan and then we've got something telling you how big something is. We need to be aware of the objectivity of those measures. So in retest reliabilities, it's different for different structures within the brain. So something like the thalamus, you can get a 6% difference depending on when you're measuring. So it's different for different structures. We need to be aware of that. The volume of the ventricles, which is kind of the hole in the middle of the brain, that changes throughout the day. So at the beginning of the day, it's different to at the end of the day, and it reflects how hydrated we are. That's one of the things. So these volume measurements aren't set. There is a range that we can get. Yeah. Okay. So that's just showing some of the volume differences that you can get throughout the day. We can also use brain scanning, not just to look at how big different structures are, but how the brain's connected. So we get these very beautiful pictures that you can get from tractography and some of the other diffusion methods, where we can see how the brain, different aspects of the brain, different regions of the brain are connected. So these are the tools that people have used to try to see whether or not there is a difference in the brains of people with gender dysphoria or transgender people and other people who don't have that. So if we're thinking about any study that is looking at brain structure, we want to be thinking about the volume. We want to be, if people are quoting volume, we want to be thinking about the error of measurement of that. So we know that it's not set. We know that any number that we get, there's an error of measurement for that volume. We need to think about it for each structure because it's different for each structure. We also need to be really aware that this is not set. So your experience will change the structure of your brain. So we know that cognitive, becoming very good at something, cognitive activity can change your brain. So we know that London taxi drivers have got bigger right hippocampi than the normal population because they use navigation skills all the time, and that's actually boosted the volume of their hippocampi. So we know that cognitive activity changes brain function. We also know that physical exercise changes brain function. So as you get older, if you exercise, you can actually boost the size of your hippocampus. You can actually change your brain structure. So it's really worth bearing that in mind. Your hippocampus is critical for memory function, something that you need as you get older. We also know that stress impacts the structure of the brain. So people with post-traumatic stress disorder, they have a slightly different brain structure. And so experience and cognitive activity change brain structure. So it's not that you're given a brain and that's how it is. Everything that we do models how our brain ends up looking. So if we think about neuroscience and the transgender brain, really we've got two kind of hypotheses going on. At the beginning, it seemed to be that these people were born in the wrong body, they've been given a female brain or a male brain. And then more recently, we've got this idea that maybe it's not more male or more female, or that's not the only thing. Somehow they've got a unique brain. There's some sort of unique thing going on with transgender people. And you will see this certainly reported in places like Scientific American, the Washington Post. There's something unique about the brains, and they've looked at some of the studies, and this is how this is reported. So really, to start looking at that, you've got to think about, is there a female brain? Is there a male brain? There are some differences, but these are group averages, and that's really, really important to recognise. So this was a meta-analysis. We heard about this yesterday, how important meta-analyses are. So they looked at 135 studies and really looked at the brains of over 15,000 people to look at male-female differences. And there certainly are group differences in some of the brain volumes. We know that males have bigger brains than females on average. But they are overlapping distributions, and I can't stress this enough. There is nothing that differentiates a male brain from a female brain that you can look at and say, this is a male brain, this is a female brain. And it's different for different regions of the brain. Some of the differences are quite small, some of them are quite different. So if we look at that, this is from the Edinburgh Brain Study, you can see how the male and female distributions of brain volume fall out over the whole brain, but also in different regions of the brain. So there's a huge amount of overlap. The differences do not differentiate, and that's the one kind of take-home message that I would like you to kind of keep in your mind. There may be differences, but they do not differentiate because of the overlap. So people who've tried to look for, the wrong brain hypothesis, somehow the wrong body, the wrong brain hypothesis, using structural MRI data, the findings have been really, really inconsistent. So some people have looked at some structures and said, well, look, these ones are bigger in our trans groups and these ones aren't, these are smaller. So there's been different structures that have been identified, like I say, different directions, sometimes bigger, sometimes smaller. Sometimes the structures are more like their natal sex, sometimes they're more like their gender, but it's all on a continuum. Everything is on a continuum. So one of the papers I think that's been used to argue that there is a unique brain for transgender people is this mega-analytic study. Now, it's not meta-analysis, it's mega. So what they actually did was go and get the brain scans of many of the people that had been reported in individual studies, and they got all of those brain scans and looked at them together. Because one of the big problems with this whole field is that you tend to get numbers of 20, not more than 25 in an individual study, so they're really underpowered. And with underpowered studies, you're going to get a lot of artifactual results. So with this study, they managed to get 214 trans men, 172 trans women, and some controls, all of whom were untreated, all of whom had gender dysphoria, but some of them had self-diagnosed their gender dysphoria, and some of them had been through quite a complex diagnostic workup. They looked at the volumes, the brain volumes, the cortical thickness, and also the cortical surface area. So three different measures of what the brain looked like in 12 different areas on the right and on the left. So you've got a lot of brain measurements there, over 70 measurements. And then they did multiple group comparisons between them. So trans men, trans women, cis women. So you ended up with a huge amount of comparisons. And this is what they came up with. So some of the brain areas, down here, you can't really see it, but each one of those coloured boxes represents something. So the blue colour is cis men is more than cis women who are the same as trans men. So that's one pattern that they've got for some of the brain areas. And then they've got another pattern where there are differences between all of those groups. So lots and lots. I mean, basically, it's kind of a map of the mess that the literature is, basically. And that's kind of what they've come up with. But what they argued was that this was a unique pattern for trans people. Now, if this is a unique pattern for trans people, we should be able to get another 200 trans people, scan them, and come up with exactly this. I would be amazed if we do that, absolutely amazed. So I'm always open to experimentation. So if we can do that, that would be great, and then we will have an answer. Yes, there is a very unique pattern, but it's highly likely that what this has come up with is finding patterns within random data, and you can always fit data to certain patterns. Also, always draw patterns out from certain data. So the other big problem for this study is that they didn't control for gender dysphoria. Some people were self-diagnosed, some people weren't. They didn't control for sexual orientation, and they did a side analysis that they put into a supplementary thing, and they found all sorts of things with sexual orientation that came out, but were very cautious about that and said, well, we can't really talk about that in the main paper because there are lots of different ways of identifying sexual orientation. Some people just said what their sexual orientation was. Some people had filled in questionnaires. So that was enough to make them take sexual orientation out of it, but they didn't do that with the gender dysphoria. In terms of the magnitude of difference, we're looking at statistical differences here. It's statistical mapping. We've got no idea the magnitude of difference. And actually what you're looking at here is just normal variations within brain structure. And we've got no idea of the meaning of that difference. You can always, with any brain, and this is not specific to transgender medicine at all. It's across the board with all brain scanning. You can always come up with something statistically significant, always, because you can play about with it enough until you do. So we don't know what the meaning of this difference is. We don't know if it's cause, effect, both, or neither. It may well be neither. And I think Anna is going to talk about many pathways into a transgender identity. And we know that some of these factors are associated with gender dysphoria. So we know that being in care and being a looked after child is associated with an increased risk of transgender identity. We know that a history of childhood trauma is the same, being same-sex attracted, having a diagnosis of autism, and we also know that there are sex differences. if all of these factors are pathways in, it's highly unlikely that we're going to come up with one bit of the brain or one sort of pattern within a brain that will say this is a transgender brain. So sort of looking at this may well describe a lot of the inconsistency. And actually, you would predict that there would be a huge amount of inconsistency in this kind of data. But that hasn't stopped people continuing to look. So one of the other ways that we can look, rather than just looking at the size of a particular brain structure, people have started to use machine learning, AI, so saying, well, it's too simplistic just to look at a brain structure, the brain is too complex, but we can feed all of the information from an MRI about brain structure, and we can just say, this is a female, we can train the machine, say, this is a female brain, this is a male brain, and then we give it a brain and say, what do you think? Is it male or female? And the results from this have been, well, mixed, I think it would be fair to say. So sometimes it can identify, sometimes it identifies a trans person as their acquired gender, sometimes it identifies somebody as their natal sex. But it's the same with cis people as well. It doesn't always get their sex right as well. And one of the reasons for that is because there is a huge amount of overlap. This is a spectrum. There is a spectrum. So this was a paper, again, that was touted as showing that transgender women have a unique brain set. So when the AI machine classified males, it put the males over there, put the females down there, and these transgender women were in the beginning. But if you look at this, they are a subset of the males. It doesn't differentiate. This is a difference that doesn't differentiate. So I think really it's a bit of a red herring looking at this. So where do we go from here in terms of looking at brain sex? Well, I think I'm going to leave you just with a bit of a checklist. If you come across a paper that says the transgender brain is unique or that it is somehow the wrong brain in the wrong body, this is the sort of thing that you need to think about. How big was the sample? And was it an adequately powered study? Probably not, highly unlikely. Have the findings been replicated? We know from brain science that very, very few brain studies, and again, this is nothing to do with transgender medicine, it's all to do with brain science. We are very bad at replicating results. People find something, big splash, things move on, and it never gets replicated. Were the investigators blinded for the analysis? We really need to be blinded when we are doing these analysis and comparing groups. Were the analysis hypothesis driven? Quite often we just see a fishing trip. We're going to just look at everything and just find a difference somewhere. So we want a hypothesis, and ideally we want a pre-published strategy. This is what we're looking at, this is why we're looking at, and this is how we're going to look at it. Did it control for differences that may be due to hormonal influences on neuronal development and brain function? I'm going to be talking about this this afternoon, but this is where we do see sex differences. So the male brain and the female brain do develop differently, and there are hormonal influences that we need to take into account. So were the patients all drug naive? Sometimes we just get a whole mix of patients. And what developmental stage and age were they at? We need to be aware of that. Did it control for biological sex? Did it control for sexual orientation? Did it control for psychiatric comorbidities like anxiety and depression and minority stress? All of these factors have an impact on brain structure. Did it control for neurodiversity? And did it control for other forms of body dysmorphic disorder, particularly in the functional imaging? I haven't talked about functional imaging. That's a whole new thing. We could have a whole conference on the brain and functional imaging and how that, some of the problems with that as well. So I'm going to finish with, is there a transgender brain? I think that's the question that I was asked to answer. So there's no consistent evidence to support that somebody's been born in the wrong body. There is no consistent evidence to support the unique brain hypothesis, but we've got somebody who said this is the unique brain, so if somebody wants to go and check that out, it's possible. Difference that doesn't differentiate groups is a very limited value, and that's the kind of key take-home message here. And the brain is not binary. This is a field that is fraught with what's binary and what isn't. The brain isn't binary, and it's not categorical. And any sex differences that do exist in the structure exist along a continuum. And if you can be a woman with that difference, it doesn't make you a man if you've also got that difference. So difference does not equal determination either. And I'll finish there.